Sport is good for you. It helps our generation of office workers, computer kids and couch potatoes to get active both physically and mentally. But this is not true for everybody. 1 in 200,000 athletes has a high risk of suffering a deadly heart attack when they exercise. It is caused by a dangerous gene defect. Scientists at the University of Pavia, Italy, discovered that if animals with the same gene mutation are set under stress, they can suffer arrhythmic cardiac, ventricular fibrillation, and in the worst case, cardiac arrest. This gene defect is rare, but this is little comfort to the families affected. Monica Metifogo needs to avoid excessive physical exercise and stress. She also needs to take medications and attend regular checkups. But she has been lucky. If the gene defect remains undetected or untreated, the results can be deadly.
In 1999, I lost one sister at the age of 14. She was at school talking to her teacher, and suddenly she collapsed and died. They told us that it was a heart attack, and we had to accept it. 7 years later, I lost a second sister at the age of 16. My husband then told me that it was probably important to investigate this matter further.
In Pavia, Monica Metifogo is looked after by Professor Silvia Priori. The cardiologist has been involved in the research project Contica, which is supported by the European Commission. The aim of the scientists is to understand the mechanism of fatal arrhythmias and develop new treatments.
At the
moment, we're treating our patients with medication called beta blockers. They block the beta-adrenergic receptors, thus preventing the release of hormones released in stress conditions. Unfortunately, about 30% of our patients do not respond to this treatment. This is why we have to add alternative treatments.
Scientists at the Medical University of Graz, Austria, are testing which substances regulate the calcium levels in heart cells. It is the calcium that makes the difference. The healthy cells contract constantly when there is an electric impulse, but the heart cells with a gene defect, as shown in the picture below, are responding irregularly. Just a few of these cells are enough to trigger a cardiac arrest. A substance that could regulate the calcium level inside the heart would be a milestone discovery, as this could not only help those cases with gene mutations, but thousands of heart patients who risk their lives when they are stressed. Everything which is an endeavor for the patients, both emotionally as well as physically, can cause serious cardiac arrhythmia, and in the worst case, cardiac arrest. Scientists are already testing several substances to reduce the risk of such serious heart problems. Patients suffering from heart insufficiency could then benefit from this research and lose their fear of sudden death.